Technically, Governor Hochul's vaccination mandate for healthcare workers goes into effect at midnight. But for area hospitals, the push was on this weekend to coax its vaccine-reluctant workers to get that shot. Good evening, I'm Mary Alice Demler.
And hello, everyone. I'm Scott Levin. The hospitals report that they have made some progress, but as our Steve Brown reports tonight, the mandate's biggest impact may be on nursing homes.
This is our best defense right now.
Governor Kathy Hochul was in the Bronx this morning urging COVID vaccine boosters, a third dose for those medically eligible, and noting time is almost up for healthcare workers to get vaccinated.
I'm hopeful I don't have to do this. I don't have to do this if people will get vaccinated. There's plenty of hours left in the day, but I also know I need to be prepared.
Like those we saw heading to work this morning in Buffalo, healthcare workers all across the state have been put on notice. They need at least one COVID vaccine dose by midnight or face possible firing. For hospitals already stressed from a year and a half of scrambling during the pandemic, it may mean big holes in staffing. Kaleida, the largest health system in the region, says it has 94% of its workers fully vaccinated. For Catholic Health, its staff is at 90% fully vaccinated. Western New York's biggest hospital, ECMC, reports 90% of its staff is fully vaccinated, but facing the loss of some 400 employees. Hochul has promised state government help finding replacement healthcare workers, but would not offer an estimate as to how big that number might be or what it may cost.
The state may have to supplement pay for people, bring people from out of state and elsewhere to entice them. I have no doubt in my mind that that's going to have to be the case as we bring people from elsewhere.
Once again, the state's Republican Party Chairman Nick Langworthy blasted the mandate, saying in a statement today, our healthcare workers are doing yeoman's work, and firing them to bring in the National Guard and foreign, unlicensed, and inexperienced workers to replace them at a huge cost to taxpayers is pure insanity. One facet of the mandate that's gotten less attention is nursing homes. Here's a list of the facilities with the lowest staff vaccination rates in all of Western New York. The first four on this list are in Buffalo. The last, with less than half of its workers vaccinated, is the Comprehensive Rehabilitation Center in Williamsville. During the height of the pandemic last year, the facility was visited by a strike team of state and federal inspectors and later fined $14,000. We did call the Comprehensive Rehabilitation Center today, and we wanted to know if the reported low vaccination rate among its staff would affect the operation there. We got no response. Steve Brown, Channel 2 News.